So the reason why I like this section so much is because people come to me and they always ask, because they know I'm microbiology, they're like, are you just like a total germaphobe? And I'm like, no, I'm an educated germaphobe. And they're like, what does that mean? So I like this section because I separate the germaphobes from the educated germaphobes. So now we're going to talk more about what is normally going on in your body, and we're going to differentiate, are all bacteria bad? No, bacteria are actually really good. There are only few ones that are actually make you sick. For instance, E. coli, you have about 3 pounds of it in your gut. Okay, that's a lot, and without them, you couldn't digest food. Okay, you are outnumbered 10 to 1 in bacteria. For every 1 cell you have in your body, there are 10 bacteria. So they definitely are, you're more bacteria than you are human. And without those bacteria on your body, one scientist said life would cease to exist without these bacteria. Why? What's their job? Why are they so important?
They keep us healthy.
How? Let's say this is the surface of my hand. Okay. Is my hand sterile?
No.
No. Now, was my hand sterile and then I put it here and okay, now it's not sterile? No, there's certain bacteria that have been there since I was born. When I was born, I was sterile. But then, what do they do when when a baby's first born? They give it to the mom, right? And the mom immediately starts transferring her bacteria to the baby. Is that okay? What are those bacteria called? The ones that are normal.
I wouldn't like the normal flora.
Normal flora. We also call them resident flora. So ever since you were a baby, you have this normal flora. Do they make you sick?
No.
No. They do 2 very important things. What do normal flora or resident flora, what do they do? You guys might know.
No.
Normal flora, they take up space and nutrients. So let's say this is my hand, and then I go and shake someone else's hand, and their hand has something that's not normal flora. Okay? It's bad. Let's say it's MRSA. Okay? It's not considered part of my normal flora. Now don't get confused. I could have MRSA as part of my normal flora, but we're assuming that this person doesn't. Okay? So if someone, what is this one called? It's not normal flora, it's, remember? Transient flora. Transient flora is the bad flora. And what does it want to do?
Take over the good ones.
Yeah, it wants to find a spot, take it over, live, and it ends up making you sick because it's not normal to your body. Is that okay?
He was saying in class, like, their number one goal isn't to, like, kill us, it's
It
just
isn't.
to survive.
A lot of people think that is the goal. Now think about Ebola. Ebola is a virus, right?
Mm-hmm.
Now we consider, people are like, oh my gosh, Ebola is terrible. It's such a good virus. It's actually one of the least successful pathogens. And you want to know why? It kills its host way too fast. Viruses need what to live? A host. So if they go into the host and kill it, can they live off of that anymore? No. So bacteria and viruses that make you sick, they don't want to kill you. If they kill you, that's like burning down their house. They don't have anywhere else to go. It's usually just they want to grow and reproduce. That's all bacteria want to do, reproduce. Okay? But in the process, they end up killing the host sometimes. Is that okay? That's not their goal. So this transient flora, he just wants to reproduce. And when he's out in the air, he can't do it. Okay? So it comes to your hand. Now, if I'm healthy and I have all this normal flora on my hand, can he find a space? No. If he can't find space, can he start taking in nutrients? No. Okay? Now, some people, what they do is they overdo the hand sanitizer. or they take antibiotics too long. Does hand sanitizer only target bad bacteria?
No.
No, do antibiotics only target bad bacteria?
No.
Now think, okay, well maybe penicillin only targets gram-positive, but are all gram-positive bad? No, okay? E. coli is gram-negative, and like polymyxin B targets gram-negative, right? It's not going to be like killing all the bad bacteria and then gets to E. coli, oh, you're gram-negative, but you're good, so I'll pass. No, it's going to kill the E. coli as well. Is that okay? So if I'm killing them by excessively taking antibiotics or by doing too much hand sanitizer, I can kill the normal flora. And then the transient flora can come in, colonize, start taking up the space and nutrients, and it makes you sick. Is that okay?
Mm-hmm.
So the biggest thing you need to know is that the normal flora is there to take up the space and nutrients. Transient flora is the flora that's not usually on your body. It comes in, and these two, the normal and the transient flora, compete for space and nutrients, right? What is that called when they compete for space and nutrients? Microbial antagonism.
Oh, that's
Okay, so microbial antagonism is a competition between the resident and transient flora for space and nutrients.
Does this only apply to bacteria?
Yeah, viruses are weird. Really, yeah, I don't want to get into that. Just think bacteria.
Okay.
Do those two make sense?
Uh-huh.
Okay. I'm trying to just, I remember, but I don't want to skip anything. Just make sure. Okay, yeah. So what does colonization mean?
Like bacteria breeding together.
Yeah, so you don't even have to think about on the bacterial side of things yet. Think about the pilgrims or the pioneers crossing the plains. When they got to the valley, they colonized, right?
Mm-hmm.
The early Americans came, they colonized the East Coast, right? So that's when they traveled to where they wanted to go. They like where they are, they set up shop and get everything ready to go. They stay there. That's colonization. So bacteria, they get where they want to go, then they set up shop and get ready to replicate and divide and all that. So for like tuberculosis, its goal is to get to the lungs. So it's going to colonize in the lungs. MRSA is going to colonize on the skin, probably. Does that make sense?
Mm-hmm.
Okay, what's the difference between a sign and a symptom?
Sign is something that an observer can notice from like an outside.
Yeah, something that you can just see,
Yeah.
right? Whereas a symptom,
It's like pain.
yeah, it's something that I like to say you go into the doctor's office and the doctor has to take your word for it. Okay? So like if I come into you guys right now and I'm like, oh my gosh, my stomach hurts so bad, can you just look at me and like measure how much my stomach hurts?
Mm-hmm.
But if I start puking all over the place, then do you really know my stomach hurts? Yeah, so puking, vomiting, that's a sign. Whereas stomach aches is a symptom. Headache is a symptom. Okay? Another example of a sign, chickenpox, the actual rash. It's obvious, right? Whereas like an itch, just on normal skin, would be a symptom. I say I feel itchy, can you look at my skin like, oh yeah, you're definitely itchy. No, unless you have like a giant rash, right? So sign is something that you can physically see, whereas symptom is something that you have to trust the person who's telling you. Is that okay?
Mm-hmm.
And then what is a primary, and this is just a bunch of vocab at the beginning. What's a primary and secondary infection?
Primary, he gave us the example of like HIV's primary.
And tuberculosis, because
secondary.
that's the best one.
Yeah.
So most people don't die of HIV actually. They die of tuberculosis. Why? What does HIV do to the person?
HIV, doesn't it slow down the
Yeah, it pretty much like takes out the most important parts of the immune system.
Yeah.
So, like I've been saying this whole semester, what is the scariest thing for a bacteria or a virus for a transient flora?
The scariest thing for
Yeah.
like to not be able to reproduce.
Yeah, that's pretty scary, but not as scary. I always say, you know when you're a little kid and you had nightmares about monsters coming up and eating you and stuff? Well, microbes, they have the same nightmares, except for their nightmares come true. Because literally monsters of the immune system come up and eat them, okay? It's scary. Macrophages are not pretty. They're like these big blobs, okay? So, tuberculosis, let's just hypothetically say tuberculosis is floating by. It looks at you and it's like, healthy immune system, no thank you, okay? I don't want to be eaten. Looks at you, healthy immune system, no thank you. Say I have HIV, my immune system's wiped out, and it's like, yeah, that's awesome, okay? So HIV is the primary infection. It's the one that made the person sick in the first place. Then tuberculosis is the secondary infection. It comes in after, and you die of the secondary infection. The only reason the secondary infection was able to kill you is because the primary infection weakened the person down enough. Another term we like to use for secondary infection is opportunistic pathogen. So it saw the opportunity and it took a hold of it. Is that okay?
Mm-hmm.
Is it always two separate microbes? Or can first wave of one come in, weaken it, and then the second wave? Or is that
I've always heard of two microbes.
Yeah, he said in class it's 2.
Yeah.